it would be under more
Yep.
and then record.
We're recording.
Cool. Let's get started.
Okay. Awesome. So this presentation is kind of just like a general overview of independent urological management for patients with spina bifida. Before we get started, I have nothing to disclose in regards to financial disclosures, I think, unfortunately, honestly. So who are we? My name is Anessa, and I am a third-year medical student.
And I'm Alan. I'm also a medical student. I'm in my 4th year, and I didn't actually realize that Nessie put all this part-time movie star in there. But I was getting water one day, and they asked me to be in a commercial for University Hospital. So that's why you see all that stuff.
Unfortunately, I'm not that famous yet, but hopefully soon. So just a general overview of what even is the urinary tract system. So the urinary tract system is basically what enables us to excrete waste in the form of urine. So if you look up here, we have the 2 kidneys, and those are what filter the blood to produce urine, and then the urine will travel down through these little tubes called ureters, and you have one on each side, and those will connect to kind of like the circular thing called the bladder. And something else that's important about the ureters is that they have a one-way valve that prevents urine from flowing back up into the kidneys. And this will become important in a few slides. So the bladder is what holds the urine until you're ready to go to the bathroom. And then at the bottom, there's the sphincter, and that is basically what prevents leakage and what enables people to be continent. The bladder also has all these nerves that are attached to it that communicate with your brain, and that's what lets you know when it's time for you to go to the bathroom. And then below, we have the urethra, which is what enters the outside world. So that's how urine gets out. And then why do people keep telling me that it is important? Specifically Dr. Higuchi. So if your urinary system is functioning well, you probably really don't think about it very often. However, if it begins to malfunction, it can have pretty serious health effects and become a pretty big burden on somebody's life. Our goal as future urologists is to make sure that the urinary tract is always healthy, not only to like preserve health, but basically to increase quality of life. There have been a lot of studies that have shown that specifically in patients with spina bifida, quality of life is related to urinary continence. So more specifically, how does spina bifida affect the urinary tract system? The first thing, which I'm sure many of you guys are familiar with, is called a neurogenic bladder. So this is when those nerves that I was talking about that connect the brain and the bladder weren't formed properly. So it can create trouble storing urine in the bladder and also create trouble emptying the bladder. And so basically the brain is just not connecting to the muscles. And then that in turn can create UTIs. And so when the bladder is not emptying properly, urine can travel back up from the ureters to the kidneys. And then another thing that's really important is incontinence. So continence is the ability to exercise voluntary control over the bowel and bladder. Many people with spina bifida are incontinent, so they have more trouble controlling their bowel and bladder. So it can result in involuntary loss of urine, which can obviously be a very large burden on somebody's life. Another thing, and that is common in patients with spina bifida, are kidney stones. And then also kidney failure, which is what we love to avoid.
So I'm gonna go ahead and jump in here now. So jumping off of what Nessie was talking about in terms of UTIs and urinary tract infections, it's especially important for the spina bifida community because about 44% will have will have up to more than 5 UTIs by the age of 15, and this accounts for a large portion of people who go to the emergency department. A lot of times people don't really know what's going on with their bodies. They're not really familiar with this sensation or this pain from when you're going to the bathroom. And so it's our goal today is to kind of talk about it and kind of explain what's going through your body during this time when you're having a urinary tract infection. So for patients, or for everyone who catheterizes, they're introducing some bacteria into their urine, into some of those, the bladder and different parts of the urinary tract that Nessie went over earlier. And although this is not always good, it's not always bad. So moving on to what exactly is a UTI, it's a combination of pathogens like bacteria or fungi, little bugs that are within your urinary system. And you're also having these sensations or these symptoms of inflammation inside of your urinary tract. So sometimes this can manifest as like a fever, or you might get chills and you're not really feeling too well. So these are times that you want to go and talk to your doctor and make sure you confirm that there's a UTI through various tests. So some of the signs that we want to think about and be conscious of are whenever your urine or your pee smells weird or looks weird, and it has an unusual odor. So another instance is whenever you're catheterizing, it's still wet, and you're not able to completely dry off. Those are also signs of UTI. You'll notice possibly some burning or some stinging, and although it's a little bit alarming, you might actually see blood in your urine. There's also less likely symptoms such as headaches and vomiting as well, but those are things that can possibly come up. So it's important to know these things so that when they do come up, you're able to talk to your doctor about it, or talk to the helpline, the nurse helpline. So piggybacking off of that, there's such things as asymptomatic bacteriuria, which means that you still have these microbes inside your urinary tract, but you haven't quite developed the symptoms, or they're just normal and they're kind of just benign and they kind of just hang out there, but they're not really causing any issues. So in these situations, if you're not actually feeling like the strong or smelling the strong odor of your urine, or it burns when you pee, or there's blood in your pee, there's not really any reason to go and address that right away. But if you're ever unsure, it's always a good thing to go ahead and ask. Next slide, please. So another question that we get a lot is, can spina bifida affect the bowels too? Definitely, it affects the way that your stool and whatever you eat and in your poop move through your stomach and your intestines. And a lot of this is because the nerves that regulate when you go poop and how you poop and how often you poop, those aren't formed completely. And these nerves are actually located low on your spine. The two main problems that you'll have with your bowel movements are it doesn't quite empty completely, so that's constipation, or in some cases it might actually just empty when you don't want it to, so that's called incontinence, and sometimes that would leak and that could be an issue. So an individual bowel program and regular toilet routine is important for the spina bifida population. And it's definitely a good idea to work with your providers on this and kind of form a good plan that's best for you. So some of these factors for a successful bowel regimen is what we call would be like a regular stool consistency. So making sure they're nice, soft. And I know this is kind of gross, but that they're nice, soft bananas, and not like hard pebbles coming out, or very loose stool like diarrhea. Another factor would be positioning yourself to make sure that you can completely empty your bowels. So whether it's the way you're sitting or how you're getting to the toilet. And then other things such as exercise and medications can definitely help make sure that you have a proper bowel program. Next slide, please.
So I'm sure Alan and I just told you a lot about some of the like urologic problems that can arise. But the good news is there are a lot of ways that can help one achieve urine and stool continence. So the first thing that I want to talk about is called clean intermittent catheterization, more known as CIC. So that is basically when you have a like plastic tube that is inserted up the urethra and into the bladder, which then allows urine to flow through the catheter, essentially like empty the bladder and relieve you of that feeling that you have to go to the bathroom. And one of the benefits of this is it helps avoid incomplete emptying. So therefore it is really good at like preventing UTIs, and it also can prevent leakage because you can have this like routine schedule of when you're emptying your bladder. So routine emptying allows urine to leave the body, and it prevents stagnant urine. So urine kind of just like staying afloat in your bladder, that also could reflux back into the kidney, which could create kidney damage, which is, again, what we want to avoid. So we recommend a normal frequency of emptying, usually at least around every 3 hours throughout the day. And then something that people use is like medication management. We specifically use anticholinergic medication, and that allows the muscles of the bladder to relax and store more urine at lower pressures. That kind of helps with the feeling of that you constantly have to go to the bathroom, and again, the incontinence. If both of those, the CIC and the medication management, isn't really doing the job, there are surgeries available. So a bladder augmentation can be done, which is when a piece of the intestine is actually used to enlarge the bladder and create a larger bladder. Surgery options also exist to treat reflux, to improve sphincter function, or to provide emptying of the bladder through other ways. Dr. Higuchi, I'm sure, can name at least 20 different ways that he can manipulate a bladder and the urinary system, which is awesome, to help people achieve continence. And then, as Alan was saying, prevention of constipation is really important. So people can use laxatives to prevent constipation, which can help achieve stool continence. And there's a surgery called the Ace-Malone surgery, which stands for antegrade continence enema, but I think ACE sounds better, which is usually done on people that have these like neurogenic type of problems with their bowels. And so it creates a channel to allow for enemas, which can help facilitate, again, predictable bowel movements, which basically allows people to have way more control over their life. So they're no longer kind of bound by when they think they might go to the bathroom and can't control it. So for this one, basically the appendix is brought out to the skin and it creates a stoma. And then that stoma can be flushed with like just a solution, and that can help empty the bowel. Sorry that was kind of just a lot of information, but basically these are all the different ways that urologists can help people with these like neurogenic type problems achieve more, not only like better health, but just more control over their lives and a greater sense of like self-efficacy.
So how can you help yourself reduce infections? It's very important to, well, first of all, to be knowledgeable about the risks that make you prone to urinary tract infections. And if you know about the risks, then you can have an idea on how to reduce the risk. So several risks include anything that can reduce the flow of your urine out of your body. So anything that keeps you from emptying, whether it's not catheterizing enough, or whether it's not having enough water or fluids throughout the day. So it's important to keep those things in mind as you move on throughout your day, to make sure you're adequately peeing and urinating enough, and that you're taking enough fluids. Another thing to consider is anything that can stop that could be a problem for urine to flow out of your urinary tract. So these things include constipation, which is what I was talking about earlier. So actually, when you are not going to number two enough, it actually builds up inside of your intestines. And that buildup of the poop inside of your intestines can actually block your pee from coming out. So they kind of play a role and they kind of play off of each other. So it's also important to keep that in mind as well. Other things that can put you at risk of a UTI are just not adequately cleansing yourself. So sometimes it's hard, but you have to make sure that you wipe and when you're showering, you clean that area, your genital area, just to make sure that bacteria and fungi aren't growing there. And when there's a growth of those microbes, they can actually go up your urinary tract, and then that can cause a urinary tract infection. And finally, just nutrition itself plays a really big role in urinary tract infections. Diabetics, in particular, if you think about it, they have a hard time taking in sugars, and so there's more sugar in their blood, and therefore there's more sugar going out through their pee. And these little bugs actually love sugar, and they kind of thrive off of that. So that makes you more prone to urinary tract infections. So some general tips. Wash your hands as much as possible, especially now during this COVID era. It's important to keep yourself sanitized, and so that when you're catheterizing, you're not like introducing more bugs from your hands throughout the days, whether it's opening doorknobs or eating food or touching your face or shaking hands. Another thing is to stick to a strict catheterizing schedule. This makes sense because you're allowing your urine to leave your body, all of your waste to come out of your body, so that more fluids can come in and wash out anything that was left over. And then also adhering to a strict bowel movement regimen. So going to number two regularly will allow you to not store your stool in your bowels, and that can kind of prevent the flow of urine. So just other tips for school children and children daycare: take as many catheters as you think you'll need when you're away from home. Another thing is to take an extra plastic bag or a container and put your dirty catheters in there so that you can take it home later to wash and sanitize very well. And it's also nice to have extra like wipes or like wet ones that will allow you to like clean off your groin or your genitals after you go number two or number one. Next slide, please. So what is the optimal surveillance for the upper and lower urinary tract? So your whole pee channel, what's the best thing to do for people with spina bifida who are more prone to urinary tract infection and other issues with the urinary system? So one of them is to ultimately, you should be deciding on these surveillance methods with your provider. That's actually the best thing that you can do. Talk to your PCP, your pediatrician, and kind of build a plan. But just some general recommendations for your own knowledge so that you can bring it up when you do see your doctor would be to obtain a ultrasound of your kidneys and your bladder every year, or whenever you have what we discussed earlier, a symptomatic UTI. So when it does pee to burn, or when it does burn when you pee, and when you have this strong odor, or when there's blood in your urine, those symptoms that we discussed earlier, that would be an indication for you to get a ultrasound if your provider feels it's necessary. Another thing is to get urodynamic testing, which allows us to kind of measure how your urine's coming out, if it's normal, if it's appropriate. It's kind of more of an objective measurement, so that allows your provider to kind of work with you on it. Another thing is to get labs. Labs are important. It's not always necessary, but for someone who's more prone to UTI, this is something to discuss with your doctor, because as Nessie had described earlier, when you're not peeing all the time, it can actually back up and it can be an issue for your kidneys, which is what we're really worried about at the end of the day. So there's certain labs such as like creatinine that can kind of tell the doctors how your kidneys are functioning. There are other urodynamic tests that I had discussed, and then cystoscopy. So cystoscopy is a way for your urologist or your doctor to take a peek into your bladder to make sure that there's no ongoing damage to your bladder from issues with your urinary tract. And that's also important to discuss with your provider as well. It doesn't have to be done as often as like yearly, but that's definitely something that you want to consider when you do see your provider. And especially during situations where you're seeing a lot of blood in your urine, or when you're getting a lot of urinary tract infections within a short period of time. Or if you have any kind of pelvic pain, these are kind of situations that you want to discuss with your doctor and possibly get a cystoscopy for. And how can, oh yeah, you can go next slide. So how can you become independent when it comes to the care of your urinary system? So always be proactive. I think that if you're proactive about your health, you can catch things early. You're talking to your doctors regularly, and you understand kind of what's going on. So situations like these lectures that we're doing, I think is great, because it kind of allows our audience, the Spina Bifida population, to get a sense of what's going on with their bodies, stuff to look out for, so that they can catch it before it gets too out of hand. And you're the one with you most of the time, every day, all the time anyways. And so it's good to have an idea of what's going on with your body. Whether you're a guardian or a person with spina bifida, or an adolescent or an adult with spina bifida, understanding and just taking the appropriate responsibilities for your own health is only going to benefit you. And so, next slide, please. We want to make sure that we emphasize that it's very important to be proactive, and to see your doctors regularly, and to bring up the issues that you're feeling since your last visit with your doctor, and even bringing up any information that you've learned that you might want to put on their radar. So not every doctor is a urologist, and not every doctor has a specialized in the urinary system, but they can definitely help guide you in the direction if you also bring up these informations and be proactive about it as well. And we know it's kind of a yucky subject. It's your pee and your poop, and a lot of people are embarrassed to bring it up, but that's what we're here for. Nessie and I are training to be doctors, to kind of specialize in this field, and Dr. Higuchi is like years beyond that, and he's kind of like our guru. So we're here to help you. And so if you have any questions, definitely feel free to email us, or talk to your primary care provider, who can direct you to better answers.
Awesome.
And we have like a few minutes for any questions that anyone has. Feel free to just drop a chat, or like a comment or a question in the chat box, or you can just unmute yourself and we can try to tackle it from here. And don't feel pressured to ask any questions or make any comments. We do have a special 30 minutes next with what we call Cindy's Corner. So if there aren't any questions, and if something comes up later, you can always email us. I think a lot of you guys have my email that I sent out the invite to, and I can definitely help address that or point you in the right direction if there's no comments.
Oh, this is a really good question that we got on the chat that I think would be helpful for the physicians to respond to. Like, how do you remember to go pee and go to the bathroom if you don't necessarily feel it?
Usually, you'll probably want to set like a timer or a reminder. And it's all about, right, like forming good habits and routines. Generally speaking, you want to try to empty your bladder every 3 to 4 hours. That would be normal. And so you just have to kind of get into a routine of setting that alarm, doing that routine consistently, when you're kind of in a normal situation. Certainly as we are, pressed for time, or as you're on vacation one day, certainly flexing those hours can happen. But I think all the people on the chat today who I know they'll tell me when they start to adjust their schedule is when they start to see problems arise, such as urinary leakage or incontinence or UTIs coming up. So it's really about, getting into a good, healthy routine, reminding yourself however you can. I think everybody has a smartphone nowadays, so setting your smartphone can be a good thing. I'm sure there's apps, there's watches. So
I always suggest, I mean, there's lots of different apps and that can help with medication reminders or caffeine reminders, and everybody tells me I'd rather just set my alarm. So I think, trial and error with these things can be really helpful, right? Like, are you linking it with other duty, sort of responsibilities throughout the day, or are you needing that sort of reminder? I wear a watch with a timer because I need a reminder for all the things, but I'm curious what helps other people.
Hey, Cindy, this is Angie. Can you guys hear me?
Yeah.
Oh,
Can
I
you
was
guys
just going to
hear me?
remind. Yeah, I can. But I was just going to remind our patients that the other thing about making sure that you empty your bladder on a regular schedule is that it will really help with prevention of bladder stones, and those form, oftentimes just because the urine sits in that bottom of the bladder for so long. So that's kind of a good thing to avoid for sure.
Well, I appreciate that lecture initially, and I'm going to try to make this topic relevant for our wide audience here, but I want to give you a little context about some of the topics and how we picked them, and then again, encourage you to keep sharing with us if there's other topic areas that are more meaningful for you. So my name is Cindy Buchanan. I am a psychologist that works at the Children's Hospital of Colorado in the pediatric urology group. And I have been partnering with a lot of the people that are on the call today, kind of thinking about how do we make, the logistical aspects of transitioning to adult healthcare easier, but also like, what are the things that we need to understand and talk about more often so that when some of these challenges or obstacles come your way, that you have some ideas about different ways to navigate them. And so for those of you that don't know, we had planned to have a transition event for adolescents and our young adults in the spring, and much like everything else that's going on in our world right now, that got postponed. But our hope is that we can still share with our patients and caregivers at Children's Hospital Colorado and then the University of Colorado Hospital information that might be helpful to optimize your health. So I can tailor this component of the presentation kind of next steps, but this is what I'm considering sort of like step one or part one of, having success in the adult healthcare world. And we're going to talk a little bit about resilience today. So I have no disclosures. And what my goal is for this short time together, and I want to save time for us to talk as well, is I want to talk about the construct of resilience. I want to share some strategies to foster resilience that hopefully will lead to increased self-efficacy, and then even like hopefully an increased belief around ability to be independent in the world. And then also talk about, like, link back together. Why am I talking about resilience and independence, and how can that help with the management of medical tasks as you're preparing for adult healthcare demands and expectations, and or as you're living it in your day-to-day life. So before I get into this, I mean, if you want to share, I would love that, but you don't have to. But when you think about resilience, like, what comes to your mind? Maybe can you think about a person who you think is like really resilient, or can you think about a situation or a time when you were really resilient in a situation that was pretty tough?
I think resilience relies on the emotional strength that one has.
Right. So part of it's what you're like, part of it's like coming up with the cognitive strategies to kind of overcome when you have a barrier, even if maybe logistically or maybe it seems like insurmountable, but like, how can you kind of keep the right mind set to be able to keep pushing forward? I think that's one component of it, certainly. Yeah. What about anyone else? Anyone else have anything that comes to mind when they're thinking about resilience, or when you think about maybe a situation where you had to kind of harness that resilience? I think like every time I had to take a spelling test, because that was like my least favorite subject my whole entire life. So excuse me if you see any errors on my slides, but I think that was like, that's a simple explanation. It's not probably the purest form of resilience, but that was something where it was like, I have this task I need to complete. It might be a challenge for me, and I've got to keep my mindset right so that I can figure out how to overcome. We can kind of come back to this as we're going over this. Maybe you'll have some other ideas. So resilience is, is positive adaptation in the context of past or present adversity, trauma, and I think more importantly for our sort of lecture series, in the context of potentially some significant medical stressors. Resilience is the way to sort of become personally and professionally successful despite these stressors or adversities. And also in the realm of resilience, it's a normal trait. Like, we all have this inborn tendency to try to adapt and cope and overcome. But, there are times when our situations become so extreme that it can become really challenging to kind of harness that. So because of that, we know it can be fostered in the right environment, and setting up an environment for yourself, for your children, for your family, where there are opportunities to foster this can be really helpful. So it's not just, do you have it or you don't? We all have it. It's just, how do you keep growing and flourishing in that domain of your life? So what we know is that, resilience is really essential to success in school or work, management of healthcare needs, coping with medical stressors, and rebounding after all types of adversity. It, can help when dealing with life's challenges and kind of shifting to do those in a more productive and positive manner. We know that resilience also plays a central role in someone's recovery and growth after exposure to stressors or adversity or medical stressors. So, you maybe have seen articles about like post-traumatic growth. It's sort of this contrast of we're going through something really significant, and as part of that, we can grow in some ways that can cause positive changes and impacts in our life. And then I also think it's even more critical in understanding how we react to stress and how we respond to medical stressors, given the chronic stress. And sometimes, I know the doctors try their best, but sometimes just the nature of it being a traumatic situation when you're dealing with medical complications or admissions, or even just fears and worries around like what's going on with my health and my body. And so I think, if we can figure out some ways to continue to build our resilience, it can make not the stressors go away, but help us to kind of go through them in a more meaningful manner, in a way that might actually create some benefit or growth for us. So I'm not going to get too much into this, but I will show you there are kind of internal and external components of resilience. But what I really want to focus on is the external factors, because those are ones that I feel like we can modify. We can set up our environment in our life in a way that where we have opportunities to be successful and build our competence and confidence, more importantly. And those external factors, we need positive experiences with others. We need friends, we need our family, we need a work environment that is supportive, we need a school environment where there's supportive people. And these positive experiences can provide support to try tasks where you might fail, or to put yourself out there and do something that you kind of never imagined that you would want to do or could. And even trying something, I think about like patients who have, had a surgery before and it was really scary being in the hospital, or some of the recovery was challenging. And then they, meet with the doctor and they hear, oh, there's this other treatment that could really help to optimize your health. And they are willing. This is resilience, where you're tapping into your resilience. They're willing to, for my overall optimal health, I'm willing to sort of try something that I know might be a challenge or might be difficult to overcome. And, I think that it's a part of it is getting yourself into situations, but also another component of it is surrounding yourself with people and having people in your life or your child's life that can help you to set your goals high, set expectations and boundaries, and rules sometimes too, which I'm sure Reed doesn't like hearing that part, but that's important too. Okay, so whenever I talk about resilience, people are like, okay, so there's this construct, I sort of get what it's about. I've read some stories about people and like acting in resilient manners, but like, what can I really do to boost my resilience? And what can I really do to maybe support that in the people that I care about in my life? Well, I think that trying to foster a positive attitude and self-efficacy can be really important. So positive attitudes, help us reflect a sense of power, promise, purpose, and self-worth in our life. And I think surrounding yourself with people that are telling you you can be successful if you try. The path to your success may not be linear, but the effort that you put, that perseverance that you have, you're continuing to push towards the goals that you have in your life. That positive messaging from other people and within yourself can certainly help to build resilience. So we build up our resilience, so then when we have an adverse event, a trauma, a stressor, we've got that in reserve that we can use to help us to cope more effectively. I think that working on problem-solving skills, we all need opportunities to develop our talents and engage in activities that are enjoyable, but it doesn't mean that they need to be easy, but learning to set a goal, figure out how to navigate towards that goal, figure out how to kind of cognitively remind yourself about the fact that you can work toward that goal are key to staying motivated and building resilience. So, you know, our support systems that we have around us, you know, we need to ask of the people that are in our lives, can you help me to, you know, problem solve this situation if I'm having challenges with it? And can you continue to encourage me, even when I'm feeling like I'm going to fail, to help me kind of think through, is there another path to get to where I want to get to? The next one on this slide is, you know, providing clear and consistent expectations. So this is true for children, adolescents, adults, I mean, seniors. Like, we need to know sort of what the rules are and what are the boundaries within our world. And these rules need to be implemented consistently. So I think that, you know, what happens is that, you know, if expectations continue to waver, or if our rules and expectations aren't consistent, then it's easier just to kind of give up when we encounter an obstacle that comes our way. Okay, the next kind of set of tips about boosting resilience and then in turn independence, like we discussed last month, we need to have manageable levels of stress and strategies to cope with our stress. You know, to be able to feel more confident and to let go of some of our stress and worries in a way that's adaptive can certainly contribute to resilience building. And we also need to see in the people that we're surrounding ourselves with positivity, you know, and for the parents on the call, you know, for, you know, modeling forgiveness, empathy, respect, you know, all of those pieces of the puzzle that can help to kind of nurture positive emotions. Of course, as a psychologist, I have to say, I also think that psychotherapy or counseling, if you find the right fit, can also be a way to help manage stress and to really foster positive emotions. I have a lot of people that will meet with me in the urology clinic and they're like, well, I don't, like, my kid doesn't have an anxiety disorder. Or the young adult will be like, I mean, I'm not depressed or anything. And it's like, you don't have to see someone to get support around coping with stressors or kind of fostering your positive emotions just because you have, you know, a mental health condition or, you know, more significant levels of distress. Like, there's opportunities to grow and work on resilience building even within the context of counseling. So I probably won't say that again, but if you need suggestions or tips around how to find someone that can help you to build your resilience, please don't hesitate to let me know. The other way that we can boost our resilience is within the realm of our healthcare, right? So, like, closely following your treatment plan, you know, asking for options or other strategies if you're not quite sure why the suggestion has been made by your medical team. And then, you know, it's probably frustrating sometimes when you come to see your urologist or Dr. Higuchi or Angie, and they're like, hey, you need to be cathing every 3 to 4 hours. Like, we need to work on your schedule. We need to get on track. But if you can successfully implement those routines and strategies, guess what? That will build your resilience. Guess what? That builds your independence. And then in the long run, that will help you to be more successful and optimize your health. So I like it when they're firm, even though it probably annoys you guys sometimes when they're like continuing to say the same things over and over again about things you do to take care of your health. But I think those expectations and boundaries are important. The last thing, which I think everyone has a hard time with this, but it's so important, is like allowing yourself to make mistakes, right? Like, mistakes happen, let them happen. Just like try to think about, how can I mess up a little bit less like poorly, or do that a little less bad next time, right? And trying to think about, you know, are there opportunities where maybe there's something that, you know, even for some of our young adults on the call, maybe there's something where you've really been relying primarily on your parents to help you navigate a certain situation, whether it's maybe scheduling appointments or, working on applying for jobs. You know what? Like, see if there's some small steps you can take. And if you mess up, you mess up, and all you do is learn from that, and you can take that into your next encounter. When it comes to making mistakes with your health, I think, sharing with your team if you made some missteps or trialed some things that weren't working well, and they can help you to kind of think through what's next. So why are we talking about resilience related to transition to adult healthcare and doing your best in your adult healthcare world? Well, I'm going to breeze through these because we're going to have some time to discuss these in future sessions. But, the predictors of successful transition to adulthood, sort of the literature supports this, is, having parents or caregivers that help to foster your independence, having high intrinsic motivation, having strong executive functioning skills, having, family or a job where you have resources to meet your socioeconomic goals. But most importantly for me, which is something that I know we can modify, is having high levels of resilience. So high levels of resilience can help us to transition to adulthood successfully. And I think this is across the board. It's not just for individuals with spina bifida, it's for everybody. Like, that transition into young adulthood can be really challenging, and trying to think through those tasks, when you might be doubting yourself or worried about making mistakes, that's when you can harness back and rely on your resilience. So what happens, and I think our docs talked about this, what happens if the transition to adulthood doesn't go smoothly? Well, lots of hospitalizations, medical complications, skin breakdown, you name it. But also, I think when you're not working on some of these adulthood tasks, it can also get in the way of you just getting access to your healthcare. So not necessarily just the complications, but just not following up as regularly. And then certainly there can be psychosocial stressors and delays. So delays around romantic relationships or employment or other areas of life that make life so meaningful. So why are we talking about all these transition things? A lot of you are already seeing an adult clinic, and we're going to need your help kind of helping the next generation of teens. But let's think about this. Initially, when you went to the pediatric hospital, oh my gosh, I'm clicking through quickly because your parents did all of the things, right? They made your appointments, they were making decisions, they were signing consent forms, they were talking with the doctors about the treatment plan. But as you turn into adolescence and adulthood, then those things shift. And guess what? All of those same tabs that I had on the responsibilities of parents immediately shift to you into adulthood, right? Can you remember the first time that you were trying to figure out if you had an authorization for a medical visit, or you were calling to get an appointment scheduled? Those things can feel really, really overwhelming, right? And that would be a time to rely back on your resilience and keeping yourself kind of pushing yourself forward. Obviously, parents and caregivers can still play a role. Some are involved if you choose. You, the adult patient, chooses to have your parent involved. They can be involved. And some are involved because of it's developmentally appropriate. So I'm just going to not read through these, but it's can you imagine how opportunities for independence and strategies to remain resilient in light of these sort of differences would be so important? So can you think of a time when you were completing one of these tasks on the PowerPoint slide when you were feeling overwhelmed or confused or totally stressed out? How am I going to ever make this happen? Can you think through having some opportunities when you were younger or when you're still young to make mistakes, to solve problems, to do some of these tasks kind of hand in hand or shoulder to shoulder with your parents might help as you're navigating the adult model of care, which is different, right? I think certainly there are ways to think through some additional opportunities to build in this domain. So before we kind of open it up to discussion, resilience, self-efficacy, and independence, as many of you already know, are necessary to navigate the transition from a pediatric care center to an adult hospital. It's also necessary as you're navigating more independence in your life and in the different areas of your life. So next month, I'm hopeful that, we'll get your feedback because we may shift our format some, but I'm hoping that we can talk maybe about some specific tasks that maybe you have been for our, adult audience that were challenging, that you wish you would have had some preparation for in advance. And then maybe for our teenagers, some things that you can start working on now to have a bit more independence and to foster your resilience related to your healthcare. So we're going to send out these PowerPoint slides, but there are some, I think, really excellent resources around managing your healthcare as you transition to adulthood, which we can go into in more detail if people are interested in this. So we have a parent toolkit on the Children's Hospital website that talks about transition of care to adult settings. The Spina Bifida Association has an outstanding transition guideline and guidebook. If you haven't looked at it, there are very relevant information for adolescents and young adults. And then one of my favorites is called this Got Transition website. And so this can be really helpful in kind of thinking through, are there some tasks that I should probably be taking a little more responsibility for or take off my parents' plate? And how do I get to the place where I can actually do that? So if this is of interest to people, we can talk about these in more detail in months to come. But I want to kind of go back to that question, and then I'll stop sharing my screen.